So we're hoping you guys thrive with Twin Cities Live this afternoon, and more often than not, you thrive with a team.
That's why we're talking about palliative care. Now, this is a subject we admittedly don't know much about. Dr. Emily Schafhauser from Minnesota Oncology is here to describe what it entails and then how it differs from other types of care that you might have heard of, like hospice. Doctor, we're so happy that you're here.
Thank you. I'm happy to be here.
This is an important topic, and I think people, the more you kind of understand these areas, you're not so shocked if they start to apply to you and your family. Is that
Correct.
the goal here?
Absolutely. Yep, absolutely. So palliative care is my area of expertise.
Yeah.
And that is a field of medicine where we're really focused on looking at patients as whole people.
Yeah.
Focusing on their mind, body, spirit, practical needs, and applying extra support so that patients can thrive.
Boy.
Okay, and so this is different than like hospice because this is just for people that, you know, just have maybe an illness, it's pretty serious, but it's not maybe life-threatening like end-of-life care.
Yeah, correct. So we're typically helping patients who have serious illness that can be life-threatening, but may not be threatening their life today.
Okay.
So in palliative care, we're seeing patients sometimes at the beginning of their disease or in the midst of the disease if they are having trouble with like symptom management or other stressors that come with the illness. And so it's a really important type of support that often patients aren't accessing because of misperceptions that it's reserved for patients at end of life.
Oh, so it's important to know so you can advocate for yourself. Now, okay, I want to ask you too. Do you find that people who take advantage of palliative care are maybe having better outcomes? Because we know that the mind is very powerful when it comes to healing.
Absolutely. And actually there are many studies that really bear that out, and the number of studies just continue to grow.
Wow.
So when it comes to, like, for instance, cancer care specifically, we know that adding palliative care to your care team can help people to feel better physically, so they have better symptom control, better management of their side effects of their treatments. They have less caregiver stress, which is so important. Our caregivers really go through so much when our patients are dealing with serious illness.
Yeah.
They also spend less time in the hospitals and emergency rooms.
No way.
And nobody wants to be there. So that's a really important outcome. And then also patients might ultimately end up doing better on their treatment. So this can be a really wonderful resource that many people don't realize applies to them.
Wow.
So when people are looking at this type of care, is there like a certain time frame that is like usually like, okay, we're going to hire this person to go into this program for 3 months, 6 months? Like, what's the duration of care?
Yeah, it's really different for each person depending on when they access us, and sometimes our involvement is kind of more condensed at certain times and then backs off if patients are doing better. So occasionally we get involved, like right at the start of the serious illness, there's a lot of stress with that and maybe symptoms that are uncontrolled. Sometimes we get involved if patients are struggling with the ongoing burdens of disease, so they might be more mid-cycle in their illness. Sometimes we're also getting involved when patients are facing really serious illness and they might be at the end of life, or facing really difficult decisions that they have to make about like different interventions such as medications, clinical trials, surgeries. They might be confused on what the best next step is for them.
Right.
And so we can get involved by helping people to understand what do those different treatment options look like for their life, and how can we help them really get clear on their goals.
Okay, so when you're presenting this to someone, does the patient need to wait for their cancer care team or whatever to say, hey, we think palliative care might be good for you? Or should you advocate for yourself too and ask for that?
Yeah, I think it's really important that patients do advocate for that, because sometimes the care teams just don't know how much people are struggling.
Yeah.
And so I think it is important for patients to be aware that this resource exists. Also, if care teams are recommending this resource, I find that oftentimes patients get worried about what this might be and what this might mean for their health, and so that can be a barrier to them accessing it.
Oh, they might think, oh, it's worse than they're telling
Yeah.
me. Yeah,
Exactly.
So are there teams that are specific to certain conditions? Like how would one, if you like, okay, I have this condition, I only need to look for this team that can help me, or are they kind of like, in general, they know it all?
Yeah, so there are different types of palliative care teams. Some teams are really focused on certain types of serious illness. So there are some teams that really focus on neurologic conditions, for instance, like Parkinson's disease or others. Some teams focus on patients going through cancer, like our team. And then there are teams that are more broad focused, where really any serious illness might be covered.
So at Minnesota Oncology, your team also includes a spiritual care provider. Isn't that an amazing approach?
Yeah, we're very, very proud of that.
That's amazing.
Yeah, well, really, mind, body, spirit, we know that all of these different areas impact each other, and you can't provide good quality of life for someone unless you're looking at the comprehensive person.
The whole person, and
Yeah.
and really acknowledging how important those arenas are when it comes to healing. I love that you all are doing that. Thank you so much
Yeah.
for being
Yeah,
here.
thank you for having me.
Boy,
Such a
now when
holistic
someone,
approach.
Yeah, and if someone says palliative care for the first time in my life, I will know what that means.
That's right. So if you
Very
feel
exciting.
a palliative care consult is right for you or a loved one, reach out to them to care for one of their care teams.
Yeah, to your care team, whoever you're working with, but the team at Minnesota Oncology, they can certainly help you. They have more than 100 cancer care providers in 13 clinics across the Twin Cities. They even have new locations in Maple Grove and Hudson. And you can learn more at the website right there on your screen. That's mnoncology.com.